For those who are just starting their career in healthcare during the pandemic, they found that this situation that we've been experiencing the last couple of months really threw their career into high gear.
And that's exactly what it did for Gage Harris. Our Sarah Jones takes us behind the mask tonight of a local phlebotomist.
Early on in the pandemic, hospitals began opening COVID-19 units.
Towards the beginning of the unit opening up, it was only nurses over there, and they were kind of having difficulty getting blood from patients that weren't just being drawn from PICC lines or central lines and things like that. And so they were talking about putting a phlebotomist over there, and so I told my supervisor I'd do it immediately.
At 23,
I got certified a year ago. I had some of the same training in my medical assisting schooling, which I just finished recently.
Just starting his career in healthcare, Gage volunteered to join the COVID-19 unit at the start of the pandemic.
It can be really hard getting blood on a patient that's been sitting around in bed for a long time. They have a lot of things going on, and I know that I have that ability to work with nurses and doctors closely without getting in their way and being able to perform.
He says he knew that if he didn't volunteer, he would regret it.
We wear respirators with the tapper hood. I wear an N95 under that. I wear gloves, and I wear a coat that's patient-specific, so we have coats that hang outside their rooms.
During this pandemic, most hospitals will tell you it's all hands on deck.
I take care of the storeroom, I take care of the coats that we use in each of the rooms, and I just answer the doorbell, and anything that comes up, I just try to take care of it and leave the nurses as free as possible so that they can do their job. I have additional responsibilities working on the COVID unit than I had before drawing blood. I've done CPR.
The novel virus was unlike anything he'd ever seen before.
The thing that kind of made me take a step back and realize how serious it could be was that they didn't know, one, whether or not, you could become immune to it after you had it, and then also that it could cause, permanent damage in your lungs.
Through this pandemic, Gage has grown closer to the doctors and nurses he works with, as well as the patients.
He was known to be a particular man, and I was the only one who was allowed to poke him, basically, because he didn't like anyone else to do it, and he ended up passing after a long stay. And it was really hard for everyone, but it was rough being there in his final moments.
He says he doesn't see himself as a hero.
My mom's a hero. She's a nurse practitioner, and she went into people's houses to do checkups on patients. She goes completely out of her own environment and really takes their entire health care into her hands.
But as the saying goes, the apple doesn't fall far from the tree.
And Sarah's going to continue to take us behind the mask the rest of this week. In fact, on Friday, you want to tune in for her story. It's about a couple. Both of them work on the front lines. One is respiratory therapist. The other works as a nurse.